Thank you so much, and thank you, OPHA. Thank you, everyone, for being here. On the program, it's called STI Criminalization in Oklahoma. The real title is I Had Sex and All I Got Was a Felony. If you look on your poster, on your pamphlets, it's what I call the sex to felony pipeline. And then the last part I will say is we are wearing little microphones because Matriarch has a podcast. We are recording this, so everybody cheer. Woo! My brief intro, my name is Tommy App. I work with Matriarch. Matriarch is a data and policy think tank. We focus on women's health, mostly in Oklahoma, sometimes federal, sometimes local, but mostly state level.
Hello, everyone. I'm Jeremy Simmons. I'm one of the directors at HOPE. HOPE is a nonprofit here in town. We provide free and low-cost STI services focusing on HIV, Hep C, gonorrhea, chlamydia, and syphilis. And
so to give some background, STI criminalization is basically what it sounds like. In Oklahoma, transmission of an STI is criminalized. It's called reckless transmission, and that is completely undefined. And it is a felony. It is a 2 to 5 year felony. Last year, there was a bill that would have expanded it to include about, was it five or six? But the ones that we currently have is a 1910 law, smallpox, syphilis, or gonorrhea. So reckless transmission of those three could land a 2 to 5 year felony. I personally didn't know why those three, and so that's why I asked Jeremy, who is actually quite well versed.
Yeah, so I'm a founder at HOPE. I haven't gone back to the 19-teens, but we started HOPE in the late 90s, and I've been doing STI work ever since then. Just, can some of y'all raise your hands real quick? Were any of you aware that it was criminal in Oklahoma to transmit syphilis or some other diseases? All right, actually quite a few of you did. I didn't hear about this information until maybe 2 or 3 years ago. So it's one of those things that came about in, I think, 1910, you said, right? It's important to, when we look at a lot of these laws, they can be very outdated so quickly. These laws probably didn't make as much sense back then, really, but at the time, there was not great treatment options for these infections. So as usual, the typical Oklahoma legislative response was, the typical legislative response was, let's make laws to punish the bad people, right? But the language that was used around it was, we have to control these infections because you can't treat them. However, many of these things are now preventable with vaccines or medication. So there's really not a need to criminalize them.
So in 2024, there was a bill called HB 3098, and I just want to give you, and HB 3098 would have added 4 or 5 additional infections to that list that we mentioned in 2024. And I just want to give you, I guess, some fun facts about what these infections included. So it included genital herpes, but that was an amendment because it initially just said herpes. So don't share a drink with someone until, later it was amended. Oh, and just for clarity, this bill didn't pass, but it got really close, I will admit. It included HPV, which many of you might know, 85 to 90% of people will contract HPV in their lifetime. That is a lot of potential felons. And also, fun fact, only women are really tested for HPV. And when that was brought up to the author of the bill on the floor, her response was, oh, well, medical technology will catch up. So for that in-between time, we were only going to criminalize women for transmitting HPV. Criminalized transmission is a felony, and so in Oklahoma, felons lose the right to vote until they have completed their sentence in full. So for transmitting gonorrhea, chlamydia, HPV, you could potentially have lost your right to vote. And just to note, the ones at the top that we mentioned at the beginning, the 1910, those are still ones that you could lose a right to vote for transmitting because, again, it is a felony. And then the last one I will mention is that HIV criminalization is a separate law. But in the HIV transmission law, there's a protection for mother-to-child transmission during birth. STI criminalization, that law does not have that. So given Oklahoma's sky-high syphilis rates amongst pregnant women, that transmission could be a felony charge of the new mother for reckless transmission. And unfortunately, even though this is under my kind of HB 3098 expansion statement, that one's current. So that could actually happen right now. Jeremy, you alluded to the fact that a lot of these are treatable or manageable. Can you give a kind of just give an overview of how manageable or treatable they are?
Sure, happy to. So syphilis, gonorrhea, chlamydia, and trich are almost immediately treatable. Simple antibiotics, unless the syphilis is quite advanced, it'll usually get rid of it within a 2 or 3 week treatment regimen, and then it's completely gone. And even before the treatment is successful, it's dying along the way. So the person becomes less and less likely to be impacted by the health effects, and even within 2 or 3 days, they become less likely to transmit on. So these infections are incredibly easy to control. It's very simple to get rid of them, and it's very easy to reduce risk around them. Herpes, some of the viral ones are not treatable, but they can be managed with antivirals. So HIV can be successfully managed with antivirals. Hep C, in some cases, can be treated and cured, completely gotten rid of. We've made a lot of progress on that. And even when we can't get rid of Hep C, we can minimize it. Herpes and HPV, honestly, letting nature take its course is the best approach. It's important to note, though, when people include laws around things like HPV and herpes, these are not things that ever do really serious damage outside of the enhanced chance with HPV for cervical cancer. That's why women should continue to get pap smears and not be discouraged from accessing care by these kind of laws. But they're not the kind of thing that are going to hurt people on average. Many people carry HPV and herpes and never have any health issues whatsoever. So no blisters, no warts, no cancer, no infections, no transmissions. So it's really surprising to see those to be added into this law.
So if you look at those flyers, and just for those listening on podcast, I've kind of characterized this as like this sex to felony pipeline. And so the best way to prevent a felony STI transmission is to educate people on how not to, acquire an STI, or best practices in not transmitting an STI. In reference to Teen Empower, we are all about prevention education. We don't use scare tactics or shame people for their choices. We provide medically accurate information to help empower young people to make healthy decisions. When it comes to STI education, we keep it pretty basic. It's most likely the first time any of the students hear about STIs, how they are spread, damage they could cause, and ways to prevent them. We cover that some are curable and the others are treatable and manageable. The older students receive lessons on barrier methods, while the younger crowd is more on abstinence, but still bring up condoms. We teach students skills on how to have conversations with parents on safer sex and the importance of getting tested. So I'm personally one of those people who kind of can't comprehend when someone reads something. Basically what she's saying is age-appropriate sex education on how to reduce STIs and STI transmission, and overall how young people can lead a healthier lifestyle. So Jeremy, you are basically on the other end of that pipeline with testing and treatment. The bill authors specifically said that reckless transmission required someone to know their status, which is kind of the opposite of Teen Empower and sex education's mission, which is no STI, no acquiring an STI means no jail, whereas yours is like jail because you got tested for an STI. Can you explain how HOPE testing would be affected and the impact it would have on the community you serve?
Sure, that's a great question. So, the gist of it is we want people coming in for services all of the time. There's already, separate from whatever the state laws are doing or not doing, there's already a lot of shame and stigma that some people have based off of themselves or their communities or their families or their churches. And it sometimes is an uphill struggle just to get people to come in and access STI services anyway. This adds one more reason why somebody might not want to come in and get a test. I did want to compare it a little bit. There's already a separate existing law in Oklahoma that criminalizes the transmission of HIV. And I don't want to muddy the waters too much because the law we're talking about is different. But Oklahoma and many states nearby have a lot of history with laws banning HIV transmission. To get to your point, almost all of them do involve some kind of intent. and which when you're looking at actual prosecution, it's very tricky. It's not the same thing as sexual assault cases, but you come across a lot of those same issues where you get people saying different versions. And much like when people have been sexually assaulted, there's additional stigma, and then they have to go and talk to so many people to try and prove that somebody else infected them. So even when we have these scenarios where there is a predatory type of person who's going around intentionally transmitting these kinds of infections, this law still doesn't usually work that well because it depends on the person who's been infected to come and be willing to talk to lots of different people, law enforcement, judge, be on record, and discuss intimate details about their sex lives and drug use and anything that is related to them being infected or exposed. So we don't see the real success from it, we just see the fear from it, and it just makes people not want to access care and services in the first place.
Have you at Hope Testing or you in particular ever been encountered with a situation like what you described?
Yeah, definitely. It's interesting. So I was just I won't mention the details. I was just, within the last couple of weeks, I was working with a partner agency, and someone was comfortable talking about the HIV criminalization laws, and she had been infected by someone who potentially didn't know he had it. So, and then he went on to infect 2 more people after her, and she couldn't, even though she suspected that he was intentionally infecting other people, she couldn't use the law to her benefit because he had not tested before her. So which is a part of the problem with a lot of these laws. You have to document who's been tested or not, right? So if there's not proof that someone has an infection and that they talked to their provider or got results sent to them and know that they have it, then you can't do anything about it. And then he has supposedly infected 2 other people after her, and neither of them are comfortable pressing charges, even though they have this on record. So even the law is just not utilized very well. It's very rare. There have been some exceptions where there are people who infect a lot of people, and someone finally comes forward and presses charges, and then temporarily that person might go to jail for 5 years or something. So one person for a short amount of time is infecting fewer people. But most of the time, we just come across these scenarios where there's a lot of misunderstanding, and it just ends up making people not want to come in.
Yeah, I think you actually kind of, from a real world example, really support what the lawmaker said on the floor itself. Both of the authors basically were just like, yes, you must know your health status in order to be able to be charged for this potential felony, whether expanded or not. So I think you bring up a point where that's already kind of being brought out with the HIV criminalization. It's really not being brought out on the STI criminalization. What's on the screen, that really hasn't been used. We asked prosecutors in various areas across the state. They didn't even really know this existed. But you know what? It appeared on the floor. It appeared in the legislature, which means someone knew it existed. Again, that start of the pipeline to the felony. And this is where I actually really relied on Jeremy to discuss. There's no sex ed mandate in Oklahoma, except for one portion. There is a sex ed mandate, but it's to talk about AIDS curriculum. And frankly, would you call it inclusive?
Not at all. So yeah, shocker, right? So there's the thing that's really, so Hope does a little bit of education. So as you can imagine, one angry school board person, one angry parent can raise a lot of noise, and that can create a lot of hassle to combat. And so a lot of people give in to these loud voices that are saying, don't say anal sex, don't say oral sex, don't say abortion, don't say Plan B, don't say homosexuality, don't say condom, don't say, etc. And so sometimes you end up doing a sex ed and an STI presentation, and really all I get to talk about is, here's the STIs, and here's what's bad when you get them. Don't get them. It's not great education, even for younger people.
And just to add on that, the law itself is very biased against gay men and basically blame gay men. And this is almost like it's taught. It has to be part of the curriculum itself, is that gay men and intravenous drug users are the problem. They're at fault. And unfortunately, that was echoed last session also. So there was a reform to the sex ed curriculum law that was proposed last year. And in the curriculum, one said that the curriculum couldn't talk about consent. That was just struck. It was struck. The author couldn't really explain why. It just was gone. But the one that I also wanted to mention was when asked about the provisions that kind of talked about STIs, one of the representatives on the committee said, asked about STIs. The author didn't know what that was. This was the author who had written the bill. He just kind of said, what is that? The representative who was asking the question said sexually transmitted infections. The author of the bill then was like, oh, I've only heard disease. So they're not inherently the wrong terms, but this was someone who was authoring this bill. And the reason I bring this up is not just for that little anecdote. When asked about talking about transmission, prevention, all that, the author said that STIs were for degenerates and they deserve it. And the reason I wanted to kind of bring that up is because it does parallel the HIV curriculum. You mentioned that you teach the curriculum. What is in it, I guess you can say, because I think most people just, if they even know it exists, just don't know what's there.
So there are mandates. They use a lot of negative language. And again, it's like, especially if they say, homosexual men are more likely to get the infection, but then I can't talk about condoms or anal sex, or I can't talk about anything around that, then I can't even really explain, why that people are higher or lower risk, why people have more or less of a disease impact burden. So I think too, I wanted to touch on, I know that we're getting close to time. I also wanted to make sure that we touched on something that we talked about a little bit with HIV and testing, but as they're trying to expand this to other STIs, it's also really important that people understand that different types of tests are more or less accurate. And sometimes depending on a person's gender or their immune system, or if they're pregnant or other factors going on with their body, they are going to test sooner or later. They may be more likely to have a false positive or a false negative. So, for example, I could be married to a woman, and if I get chlamydia first and then transmit it to her, but she does a urine test instead of a vaginal swab test, she will likely test negative, while a man will likely test positive very quickly on a urine screening. So even you have to get really into the minutia to be able to tell who gets infected first and who would test positive first. So as we open it up to all of these infections, as they're trying to do, each one has a different way to screen for it. Each one is going to show up sooner or later in different people, depending on a wide variety of circumstances. So even if you think that this is a legit law, that finding the first person, the guilty person, is so important, and then the next person, it's really based off who is showing up for testing, what their gender is, what type of screening it was, what's going on with their immune system, et cetera. So that is something too that I think we didn't have time to touch on yet. I wanted to add in there really quickly that I think is getting lost in the mix.
Yes, I'm happy to be corrected to add better information. I don't get to say this very often, but there actually is a positive out there. Again, I don't get to say this very often. Last session as well, how many of you know what expedited partner therapy is? I see a couple hands. So in expedited partner therapy, they made it a statewide approval. Before it was just kind of test cases or test sites in Tulsa and Oklahoma City for the most part. Expedited partner therapy allows someone to go in. If they test positive for an STI, they can just get prescriptions for the partners that they can identify right there. It's a great public health measure and it does reduce transmission, but I wanted to then put a damper on that to just ask, Jeremy, with this kind of expansion, I think you all can already assume what is the downfall of that going in and having to identify partners.
So expedited partner services basically means that we can go ahead and treat additional people that come in who may have been exposed instead of having to wait on their positive results, right? HOPE's been doing it for a long time based off of, we follow Tulsa County Health Department guidelines, which gives us a little bit of umbrella to kind of be more aggressive and proactive around things. We still test people when they first come into the visit to make sure they don't have another type of infection, right? But so if I have chlamydia and I bring my partner in, we're going to go ahead and treat them for chlamydia as well at the same time. It saves on a lot of time and a lot of unnecessary hassle. And when many people have multiple partners, so a lot of times all of these laws are also talked about as if there's just monogamy between a man and a woman, when in reality we know that many people have multiple partners at the same time. And so it's also really important that people do these partner services, because when it comes to chlamydia, gonorrhea, and syphilis in particular, we just need to treat them as quickly and aggressively as possible. So the treatments are very successful, they have very few side effects, and then everybody feels better and doesn't transmit on. There's like a no loss scenario, right? So yeah, expedited partner services is great. People are starting, at least in the cities, to start to sort of expect that kind of care, which is nice. The downside again is, especially if we start seeing more punitive laws, then there's going to be this push. It's like, well, I don't want to have documented that I have chlamydia, syphilis, or gonorrhea, or especially the first person to have it in a partnership, right?
And then as we come to a close, what I like to do is just, ask, and someone who I'm talking to is, what would they want to say? What else have they got going on? So is there anything else you'd like to mention?
Sure. So Hope just opened up a new clinic. We are able to test, we went from 3 rooms to 6 rooms. We're able to see a lot more people for free STI services and treatment on Mondays and Thursdays. So please feel free to send people our way. So if people do need resources, there are some oases still in Oklahoma that will continue to function. Unfortunately, some places like Planned Parenthood have lost a lot of their funding, so it is getting a little bit harder to find some resources. But about half of the county health departments, and in Tulsa and Oklahoma City, there are still free, non-judgmental options that see people after hours.
Well, I think that is time. I'm getting the hook over here. Thank you, everyone. Thank you for joining.
Thank you.
This has been Policy in Pink, presented by Metriarch, a public health think tank dedicated to Oklahoma women. Join me, Tommy, and a parade of esteemed experts every other week as we discuss the political banter surrounding women's health. Find out more about the topics featured at matriarchok.org. That's Metriarch with an E, a fun little play on matriarch and metrics. You can also find us across social media as Metriarch OK. Thank you to our producer, Rant9 and Jesse Ulrich. And once again, my name is Tommy. And remember, all policy is health policy.